Namaskar. Welcome to Prakash on Basics. I'm Prakash Zog, and we've been talking on lasers. The importance of any invention depends upon how it can be applied, what are its uses, what are its applications. In present day situations, nothing can beat the achievements of lasers that we've been seeing around. Since its invention, the development and uses of lasers has shown an exponential growth, very rapid, and a very big change. Uh, from today, for a couple of days, I'll explain some of the more common applications of lasers. Sometimes it's a bit of technical aspect. At places where required, I'll try and simplify things as much as possible. Uh, to understand the applications, let me remind you of the properties of lasers that we have already discussed. It's a very sharp beam, it's highly concentrated, it has very high temperature. It can be either a continuous beam or it can be an extremely high frequency, short burst type of a radiation that takes place. It can be focused um, and it is electromagnetic in nature. All these properties we've already talked of. But what makes lasers more special is that uh, it gives us a precise delivery of the energy. Uh, it can be used at a number of places as I'll come across. There are a number of areas, and these applications are more like an iceberg. What you see is very small, one tenth of what actually, one seventh of what is actually visualized and seen by many other people around. I'll first concentrate on some of the major areas. And let's begin with the one that is most important for us, which is medical applications. Whenever we talk of this, we need to look at three aspects: medical diagnostics that deals with detection. Then we need to talk of medical treatment, uh, and we need to talk of therapies, and we must also look into a major area which is laser surgeries. To check, find out, this laser beam can be coupled with an optical fiber, something that we had talked of long back, and that helps us to not only illuminate the innermost parts of our body through endoscopy. So this becomes an endoscopic tool, a lighting tool. Not only lighting, but it can also be used for special purposes, as I'll come to. The most important thing that is talked of in lasers many a times is the tool that is used to cut open things. And in medical terms, it is known as a scalpel. Think of a surgery that's going on. So the doctor, wearing all his tools after due precautions, cuts open a person's stomach. And immediately, as it opens out, all the veins and arteries inside immediately there will start bleeding. So previously, what they used to do is immediately there would be a couple of assistants who would immediately clamp on um, clamps to ensure that the blood flow doesn't continuously flow into the cavity that has been opened out. But still, the whole thing would be full of blood, and the doctor would have to go through the surgery through this mess of blood and hunt around for whatever was required. It's all gone now. Things have changed. The biggest advantage of lasers is that it is a highly accurate tool. It is very precise in its nature, and there's no problem of contamination because nothing touches the body at that point when it is sliced open. And it's a very fast tool. These are some of the major advantages. Uh, and it can be controlled precisely by the person handling it, provided, of course, he is aware of the techniques. So, what it does is you use a beam and slice open the area that you're interested in. So, it cuts, seals, sterilizes all the tissues that are there very accurately. And the blood vessels are immediately vaporized and sealed off. Uh, and so this becomes what is technically known as bloodless incisions, or cutting without flow of blood. The second major area where we always hear of how lasers work in medicine is something that we talked of to a small extent long back when we talked of our eye and its surgeries. All of us have now heard of the word LASIK that we discussed long back. So all cataract surgeries are now done with the help of laser tools, because these tools are, as I said, very precise and can give you a burst of very good amount of energy, and that can be used exactly as you want. They can be used for reshaping of the cornea and the lens if required. Uh, that will change the focal length and adjust it to whatever we want. There could be pulses that would be given, and these pulses will be the ones that can be used to fuse and solidify things and fix them up once for all. So it can reshape the lenses. It can take care of retinal tears that are there. The retina itself might get destroyed or detached, um, or it could be infected. So all that area can be covered by using precise, uh, very high frequency femto. Femto is 10 raised to 18. So 1 followed by 18 zeros. Population of India is around 10 raised to 9, that is a billion. You have one India for every Indian, and that is the amount of number that you would get. And that's the frequency of these femto frequencies, laser beams. But early, right in the beginning, these laser beams were used to destroy retinal tumors that had caused blindness or affected the eye, resulting. That was a time around 61, early times of when lasers were actually put to practice also. There's one more technical term. It is known as photocoagulation. What it means is that because of light, and the blood, as you know, when exposed, solidifies. So to coagulate is to solidify. So it is possible that if the retina is getting detached or something of this sort, such photocoagulation can be brought about, and you can prevent retinal detachments. Uh, these can also be used for plastic surgeries and scar treatments because of another term that we must know. It is known as laser ablation. What happens is this pulse of lasers removes material by evaporating the topmost surface. It's very fast, so the energy goes only to that particular spot and point and evaporates that particular part completely. That is known as laser ablation. It is used not only in medical field but other areas also. It removes. So if you keep using pulses of this sort, you can remove malignant tumors. You can use remove ulcers if they are there. Uh, there is another area that is stopped off sometimes, which is known as uh, lithotripsy, which is crushing the stones that are formed in the kidney. A pulse of this sort can constantly keep on hitting a stone, kidney stone that is formed inside, and then it is possible to crush it out. Once it gets crushed, it can be drained out through normal processes. One more area, and that is typically referred to as cosmetic dermatology. Dermis is the skin that we have. So, And cosmetic surgeries are required, insisted upon by ladies and many others also. So, what do? You can remove hair. uh, you fall in love with somebody, form a tattoo of his name on your hand, and then fall in love with somebody else, and you need to remove that tattoo. Now, once it is formed, it's very difficult to remove. Uh, so, what do? You use a laser beam and keep on vaporizing the ink that is there and remove that surface of the spots, precise spots where uh, the skill pigmentation has been modified because of the inks that have been added on. So removing tattoos is possible because of this. Some people are born with birthmarks. These could be patches of red or dark skin colors, and the color below it is usually identical to normal skin color. So what you do is you again point the laser spots and remove these birthmarks if required. So screen treatment, sometimes the surface gets bad, and there are defects that are formed on the surface which have to be burnt out. But cutting out the skin may not be really very advisable. So in that case, such surgeries will tend to remove or cause the removal of the top surface that is available. One more area nowadays, as age catches on, many people have backaches and back pains, and in our bone structure, in our spine, there are some discs, and either uh, they get worn off, or because of your posture, your angle of standing, if it is not consistently on one side, then what happens is you tend to always move like this, and in that case the disc that is there inside will tend to bulge at one point and be less on the other side. And then once that happens, you always, the whole spine gets misaligned, and this problem will continue, and then you will keep on bending more and more, and some people you will see will keep on bending to a very large uh, extent. So what does the beam do? So you have a laser beam, and so it burns off the excess bulging that is there in these discs because of deformation. And so the bulge that was there like this on top is gradually flat cut out, and it comes back to its original normal level, and so the spine gets more comfortable, more erect, and the pain subsides to a great extent. It removes or relieves the pressure that is there on the backbone at a particular point. It can result into a lot of strain on the spinal cord itself, which will result into a lot of pain. So you will find that there are so many applications. How it is used in surgery for the eye, we've already talked about. But there are places where things may be delicate, removing of tumors. So, using an endoscope, the laser beam is directed inwards and the corresponding treatment is carried out. Dental surgery, many a times nowadays, where teeth cleaning and other issues are concerned, such tools, laser tools, can be used to remove the topmost surface, which could be either some growth or infection or uh, plaque or other areas, which can then be removed. And this is only surgery. This is how lasers are used in medicine. And I have just touched the top part that is commonly known to us. There are many other areas where lasers can be used. I'm going to come to them gradually. Uh, if you liked whatever I have said, uh, please like and subscribe to this channel. Tell your friends about this. Uh, Let them know that you also know of what lasers are really useful for. And this is just the beginning of their uses. We are going to talk of the other uses also, which are equally fascinating and quite common nowadays. Till we meet to discuss them out again. Namaskar.